Hello to everyone. So today we will discuss the Aiims Bilaspur Tutor memory based solution that is for the main paper held on 2nd June, and total questions were 60, and I have made 50 questions that are purely on memory based. So let's start. A 60-year-old man with 30-year history of smoking, present with progressive dyspnea. Investigation reveals hyperinflation of the lungs and reduced gas exchange. Which structure is primarily affected? Trachea, bronchi, alveoli, or pleura? So the correct answer is alveoli. A patient with tibial fracture has a cast applied and is instructed not to wear the weight on the affected leg. Which crutch gait should be used? 4-point gait, 2-point gait, 3-point gait, or swing through gait? So, instruction is not to wear the weight on affected leg. So, in this, the 3-point gate will be used. A student fail in the final university examination but perform exceptionally well in an interstate cricket competition. By focusing on sports achievement after experiencing the academic failure, which defense mechanism is being demonstrated here? Displacement, compensation, projection, or regression. So in this, the compensation is demonstrated. A pregnant woman has a blood pressure of 160 by 95 on two separate occasions. She has no headache, visual disturbances, epigastric pain, seizure, or other symptom of preeclampsia. What is the most appropriate nursing intervention? First, advise complete bed rest and continue blood pressure monitoring. Second, start MGSO4 therapy immediately. Third, induce labor immediately. Fourth, no intervention is required. So there is no sign of eclampsia or preeclampsia, but the patient is having high BP on two separate occasions. So in this case, advise the complete bed rest and continue blood pressure monitoring. A client with severe preeclampsia is receiving MGSO4 therapy. During assessment, the nurse noted that absent knee reflex and respiratory rate of 10 breaths per minute. What should the nurse do first? Continue the infusion and reassess in 1 hour. Increase the infusion rate. Stop the magnesium sulfate infusion and notify the physician. Then encourage deep breathing exercises. So, absence of knee reflex and respiratory rate that is low indicates the MGSO4 toxicity. In this case, stop the MGSO4 infusion and notify the physician. A senior nurse assigned the task of administering medication to a junior nurse. However, the senior nurse continues to monitor the work and remain responsible for the outcome of the patient care. Which management principle is best illustrated here? Autocratic leadership, democratic leadership, delegation with accountability, laissez-faire leadership. In this, the delegation with accountability is demonstrated. A patient with schizophrenia who is receiving antipsychotic medication become excessively restless, unable to sit, and continuously pace around the ward. What should be the nurse's most appropriate action? First, apply physical restraint immediately. Second, monitor for other signs of EPS and inform the physician. Encourage the patient to sleep and avoid activity. Discontinue the antipsychotic medication immediately. So, in this case, the patient is receiving antipsychotic medication and having excessive restlessness. So, this is akathisia. And so, we have to monitor for other signs of EPS and inform the physician. What MDG goal for HIV 95% by 2025 states? So, this is Millennium Development Goal for HIV. What is the 95% meant? 95% of the people should receive HIV vaccination. 95% of people living with HIV should know their status. 95% of pregnant women should be screened. 95% of general population should undergo annual HIV testing. So according to the MDG goal, the 95% of people living with HIV should know their status. A patient diagnosed with the major depressive disorder has persistent sadness, loss of interest in activities, and feeling of hopelessness. Which therapy is considered most effective for treating depression? Aversion therapy, cognitive behavior therapy, flooding therapy, systemic desensitization. So for the depression, CBT is used. According to the Freud psychosocial theory, in which stage do the Oedipus complex and Electra complex occur? Oral stage, anal stage, phallic stage, or latency stage? So these occur in the phallic stage. During an immunization session, a health worker reconstitutes a measles rubella vaccine vial. Only 6 doses are administered and some vaccine remain in the vial. According to immunization guideline, what should be done with the remaining vaccine? First, you have to store in ILR and use within 12 hours. Second, store in ILR and use within 24 hours. Third, use within 4 to 6 hours of reconstitution and discard any remaining vaccine thereafter. Fourth, discard after 28 days. So, for the measles and rubella vaccine, you have to use within the 4 to 6 hours of reconstitution and discard any remaining vaccine thereafter. So this is the start question. The age in year of 11 patients attending a health camp are, I have arranged the values in the ascending order. So these are 11 values. So you have to calculate the mean, median and mode respectively. So as we know that mode is the most occurring value. So in this, the 28 is most occurring value. So mode is 28. So for calculating the median, we need to find out the midpoint. These are 11 number. So how to calculate the median? N plus 1 divided by 2. So n is 11 and plus 1 12 divided by 2 6. So sixth value will be median. 1 2 3 4 5 6. So 28 is the median as well as mode. So only one option is having 28 median, 28 mode, 28 median. So we need not to calculate the mean, and this is the correct answer. A newborn female has a 46 XX karyotype and present with the ambiguous genitalia. The physician suspect congenital adrenal hyperplasia due to 21 hydroxylase deficiency. Which diagnostic test is most appropriate to confirm the diagnosis? Serum cortisol level, serum 17 hydroxyprogesterone level, karyotyping, growth hormone assay. So the test for this is serum 17 hydroxyprogesterone. A patient with schizophrenia tell the nurse that television is talking about me and sending me special messages. Which type of delusion is the patient experiencing? Delusion of grandeur, delusion of persecution, delusion of preference, and delusion of control. So in this, the delusion of preference. A patient achieve return of spontaneous circulation after successful CPR. The patient vital signs are stable, but the healthcare team want to minimize neurological injury and improve the neurological outcome. Which intervention should be prioritized according to post cardiac care guidelines? Start chest physiotherapy immediately. Therapeutic temperature management, restrict all IV fluids, place the patient in Trendelenburg position. So, to protect the neurological injury and improving neurological outcome, we have to maintain the therapeutic temperature. A child is brought to emergency department with high fever, severe headache, neck stiffness, photophobia, and altered sensorium. Physicians suspect acute bacterial meningitis. What is the priority intervention? First, perform lumbar puncture as early as possible. Then, obtain blood culture and administer prescribed IV antibiotic promptly. Encourage oral fluid intake. Keep the child in a bright lit room for observation. In this case, we have to obtain the blood culture and administer the prescribed antibiotic promptly. That may be started empirically, and later on, a lumbar puncture will be done, and then the confirmatory antibiotics will be started. So, first of all, we have to start the antibiotics. A patient diagnosed with vitamin B12 deficiency anemia asks the nurse about the food that are rich in vitamin B12. Which food should the nurse recommend? As we know that vitamin B12 deficiency occur in the person who are vegan, who are purely vegetarian. So the main source is organ meat, egg, and milk. A pregnant woman visit a health facility for antenatal care and is advised HIV counseling and testing to prevent the mother to child transmission. Which type of ICTC service is the most appropriate for her? Facility integrated ICTC. A patient present to outpatient department with hypopigmented skin patch that has loss of sensation to touch and temperature. Which condition is most likely? Psoriasis, leprosy, eczema, vitiligo. So in this case, this is the leprosy. Committee which recommended the establishment of primary health centers as a basic unit of rural health services in India. Which committee gave this recommendation? Srivastava Committee, Bhor Committee, Mudaliar Committee, or Kartar Singh Committee. So, Bhor Committee gave the primary health care concept. A nurse researcher want to evaluate the effect of mindfulness based cognitive behavior therapy program on stress level among the nurses working in oncology unit. Which research design is most appropriate? Cohort study, prospective study, one group pretest post-test design, case control study. In this, the one group pretest and post-test design will be used. Pregnant woman in active labor is referred to a first referral unit due to non-progress of labor. On assessment, the cervix is fully dilated, membrane are ruptured, but there is no descent of head despite adequate contractions. What should be the next intervention? First, perform pelvic examination to assess the cephalopelvic disproportion. Wait for spontaneous delivery as there is no pain after ARM. Repeat artificial rupture of membrane or encourage the mother to walk or continue labor. In this case, perform the pelvic examination to assess the CPT. A patient with dehydration is admitted to the hospital. The nurse explained that water reabsorption in the kidney is primarily regulated by which hormone? Aldosterone, antidiuretic hormone, thyroxine, or cortisol. So, water resorption in the kidney is mainly done by the antidiuretic hormone. A child with extensive burn injury is admitted to emergency department. Which electrolyte imbalance is most likely to occur during the initial phase after the burns? Hyponatremia and hypokalemia, hypernatremia and hypokalemia, hyponatremia and hyperkalemia, hypernatremia and hyperkalemia. As we know that in the burns there is a hyperkalemia and potassium and sodium are contra to each other. So hyperkalemia and hyponatremia. A qualitative researcher interviews the family caregiver of the patient with dementia. After analyzing the interviews, the researchers share the interpreted findings with the participants and ask whether the result accurately reflect their experiences. Which technique is being used? First is triangulation, then we have member checking, audit trail, or peer debriefing. So in this, the researchers is returning back to the participant for the confirmation. This is the member checking. A 6-month-old infant is brought to the emergency department with recurrent vomiting and sunset sign. Which condition is most likely responsible for these findings? Meningitis, increased ICP, cerebral palsy, febrile seizure. This is increased ICP. During a vaginal examination, the nurse finds the fetal head is at 0 station. Sagittal suture is aligned in the transverse diameter of the maternal pelvis. This finding indicates which fetal position? Occipito anterior, occipito posterior, deep transverse arrest, row presentation. 0 station is at ischial spine and suture is aligned in a transverse diameter. It indicates the deep transverse arrest. A 7-month-old infant can sit with support, travel sounds such as mama and dada, but not yet crawling. How should the nurse interpret this finding? Normal growth and development for the age, gross motor developmental delay, cognitive developmental delay, severe developmental abnormality. So in this case, it is the normal growth and development for the age. A patient is unable to extend the wrist and finger, causing the hand to hang limply in a flexed position, that is wrist drop. Injury to which nerve is most likely responsible? Median nerve, ulnar nerve, radial nerve, or musculocutaneous nerve. So in case of wrist drop, radial nerve is involved. An adult patient is diagnosed with a condition in which oxygenated and deoxygenated blood mix between the atria. Due to the persistence of the fetal opening that normally closes soon after birth, which structure has failed to close? Ductus arteriosus, foramen ovale, ductus venosus, umbilical vein. So there is a mixing of blood between two atria and the failure to close is foramen ovale. Which toxin is responsible for the clinical feature of cholera? Endotoxin, neurotoxin, enterotoxin, or Shiga toxin? When this the enterotoxin. In a, if a male is affected with a genetic disease, what is the chance of transmission to his offspring? 100%, 50%, 0%, or 25%? So the chances are 50%. A patient diagnosed with beta thalassemia major, they are worried about the future pregnancy and seek advice from the nurse. What is the most important nursing intervention? Start iron-rich diet, give vitamin B12 supplementation, provide couple counseling and genetic testing, advise immediate splenectomy. So in this case, you have to provide the couple with the counseling and genetic testing. During a cold calorie test, the cold water is instilled into the right ear and the patient shows slow deviation of the eye toward the right ear, followed by the nystagmus. This response indicates damage to the brainstem, intact brainstem reflex pathway, lesions of the optic nerve, cerebellar hemorrhage. So, in cold calorie test, the water is instilled in the right ear and patient is showing the reaction toward the right ear. Deviation of the eye toward the right side. So this indicates the intact brainstem reflexes. A 30-year-old patient diagnosed with the Post-traumatic stress disorder report severe anxiety, flashback, and difficulty sleeping. What is the most appropriate medication for short-term relief of the sleep disturbances? Sertraline as a long-term first-line therapy, haloperidol for acute management, alprazolam as a mild sleeping agent, lithium carbonate for mood stabilization. So, for this, alprazolam as a mild sleeping agent can be given. A newborn fails to pass meconium within the 24 hours of birth. On rectal examination, there is explosive leakage of release of gas and stool. Which diagnostic test is used to confirm the condition? Abdominal X-ray, ultrasound, abdomen, rectal biopsy, serum bilirubin level. For this, the rectal biopsy is used to confirm the condition. A patient with kidney disease developed generalized edema. Which mechanism is primarily responsible for the formation of edema? Increase plasma colloid osmotic pressure, decrease plasma colloid osmotic pressure, increase red blood cell production, decreased capillary permeability. So mechanism for that is decrease in plasma colloid osmotic pressure or oncotic pressure. A nurse is assessing a patient airway using the Mallampatti scale before surgery. What is the primary purpose of this assessment? First is to assess the risk for aspiration, to evaluate the difficulty of endotracheal intubation, to measure oxygen saturation, to determine lung capacity. Mallampatti scale is done for the to evaluate the difficulty of endotracheal intubation or mouth opening. A 4-year-old child is brought with painless abdominal swelling. The nurse suspects Wilms tumor. Which finding is most relevant during physical assessment? Hematuria, palpable abdominal mass, hypertension, explosive stool pass on rectal examination. So for the Wilms tumor, light palpations can be done, but not deep palpation. So in the assessment, there will be the palpable abdominal mass. A 3-year-old child is brought to the pediatric outpatient department with cough and fever, and nurse counts the respiratory rate, above which value should the nurse classify the child is having tachypnea. So age is specified as a 3 year, and when it is called tachypnea, when the heart rate, when the breath is greater than 20 breaths per minute, greater than 30 breaths per minute, greater than 40 breaths per minute, greater than 60. According to age, greater than 40, tachypnea. A nursing superintendent reviews the annual performance appraisal report of staff nurses and conducts the performance appraisal to evaluate their work and provide feedback. This activity is an example of which function of management? Planning, organizing, directing, or controlling. Review of a part is under the controlling. A nurse is implementing evidence-based nursing practice while planning care for a patient. Which of the following is not a component of evidence-based nursing practice? So it has 3 components: the best available research evidence, clinical expertise of healthcare providers, patient values and preferences, patient opinion without scientific support. This is not a component. Other 3 are the component of EPNP. A nurse manager is classifying inventory item using ABC inventory control method. According to ABC analysis, item A refers to low cost items with high quantity. B, high cost items requiring strict control. Moderate cost items requiring periodic review. D, essential item irrespective of cost. So Item A are high cost item that requires a strict control. A nursing educator uses a role play to teach students how to communicate with anxious patients. Which learning domain is primarily affected by this teaching method? So, as we know that the role play has impact on the affect. So, it comes under the affective domain. A woman is diagnosed with the cystic ovarian mass, and the fluid aspirated from the mass is most likely to contain gastrin, fibrin, albumin, or globulin bile pigments. Most likely contains the albumin and globulin. Patient with severe liver failure develop confusion, altered mental status, elevated blood ammonia level, which metabolic pathway is most likely impaired. Krebs cycle, glycolysis, urea cycle, Cori cycle. As we know that it is elevated level of ammonia, so urea cycle is impaired. A bedridden patient is assessed by a nurse and found to have a grade 4 pressure ulcer. Which finding is most likely present? So it is asking about the stage 4 pressure ulcer. Non-blanchable redness over the intact skin. Second, partial thickness skin loss with blister formation. Third is full thickness skin loss with visible subcutaneous fat. Three is full thickness tissue loss with exposed bone, tendon, and muscle. In grade 4, we know that there is exposed bone, tendon, and muscle. A pregnant woman at 26 weeks of gestation visit the antenatal clinic for routine screening. Which test is most commonly used to diagnose the gestational diabetes mellitus? First is HbA1c. Second, RB, random blood sugar, RBS. Third is oral glucose tolerance test, which is urine glucose test. Most commonly done is OGT, oral glucose tolerance test. A researcher study report a p-value of 0.04 and Cohen d of 0.01. How should the finding be interpreted? First, statistical significant with negligible effect size, not statistically significant with large effect size, statistical significant with large effect size, not statistical significant with negligible effect size. So Cohen d indicates the effect size and it indicates the negligible effect size, but p-value is the statistical significant. So first option is correct, statistical significant with negligible effect size. A patient with acute ischemia stroke present 10 hours after symptom onset. The stroke team perform advanced imaging to determine whether treatment may still be beneficial. Which finding is most important in deciding the further intervention? A. Presence of cerebral edema. B. Presence of ischemic penumbra. Presence of fever. And presence of hypertension. So, the most important in deciding the intervention will be the presence of ischemic penumbra, because the penumbra is the area that is salvageable, means that can be revived with the intervention. So, with this, I have completed the 50 questions. So kindly like and subscribe my channel, that is the RNCCN, for the further videos and other nursing related content. Thank you.